We're trying to create a heightened awareness of Parkinson's disease in the Black and African American community so that people can feel educated and empowered to seek the healthcare that they need. It is your right to seek healthcare and to make sure that your concerns are addressed. For me, being culturally competent means meeting my patients where they are, thinking about where they are culturally, from an educational background, from their priorities, and their goals in life. So I think it's really critical to have an understanding of who that person is beyond their diagnosis, whether it be Parkinson's disease or something else.
So we'll start with you just looking at my finger. Follow my finger with your eyes.
I'm reminded of a gentleman I met a few weeks ago in my office. He's 85, African American, and actually was coming to see me for balance issues.
Let's take a walk in the hall, okay?
He expressed that for him, in his upbringing, he was often advised not to go to the doctor. He was advised often to just manage his symptoms on his own or accept that this was part of normal aging. For this individual, he reminded me how important it was for me to think about his context, his history, and his experiences with the medical enterprise so that I could better provide education, information, and treatment that met him where he was. I think sometimes when you find someone who looks like you, it's easier to relate to that person because they might have a shared lived experience. That being said, sometimes people can look like you and have a very different lived experience. Asking a friend or a trusted advisor, someone in your family, someone you work with, someone that is a social acquaintance. Also, you could look to community-based organizations or faith-based organizations and leaders to identify a reference or a referral to a trusted provider. Your primary care physician, if that's someone you feel comfortable with, could probably connect you to someone that you might relate well to. And finally, there's online resources where you can read a bio or a description of the provider and see if their priorities match yours. So I always advise people that if you find yourself in a relationship with a doctor and you're not comfortable, you don't feel listened to, you don't feel heard, you have every right to seek another opinion. And sometimes it's a little bit like speed dating, where the first or second interaction may not be a good fit, but hopefully you can find a provider who you click with and you feel comfortable sharing with, because with Parkinson's disease and other chronic conditions, you likely will have a long-term relationship with this provider, so you want to be sure that it's someone that you can trust.